Today we have the privilege of talking with a living legend, Dr. Beverly Coleman. Dr. Coleman is the first African-American female full professor of radiology at University of Pennsylvania, first endowed chair of fetal medicine at Children's Hospital of Philadelphia, and the first African-American president of the American College of Radiology. She'll walk us through her journey growing up in segregated Pine Bluff, Arkansas, to Vassar College, and then to graduating from Harvard Medical School in 1974. Dr. Coleman has gracefully leaped hurdle after hurdle, achieving a long list of accomplishments. She's reached so many by helping countless patients, lecturing all over the globe, and having a hand in teaching numerous practicing physicians. As she shares her story, it will be obvious that her guiding lights are patient-centered care, decreasing disparities, and never giving up. She's a force that won't be stopped. What an honor. Let's go.
Excuse me, is this the reading room?
Yes, I'm Dr. Saad Manzoor.
I'm Dr. Travis Howard.
Welcome to the reading room.
So your challenge on your journey to be as educated as you are as an African-American female, how did you do it? Let's talk about some of those obstacles you had to get. You kind of touched on several of them already.
There are so many.
Yeah. But,
I told you, they just keep coming.
yeah.
You think to yourself, okay, when is this ever going to end?
Oh my. Yeah. Oh man.
And you realize that people need to see you.
Mm-hmm.
Okay. So, when I go down to the cafeteria,
Yeah.
hi, Dr. Coleman. It's always been the case.
Mm-hmm.
How you doing? Da da da. I don't care if they got a mop or a broom. I'm walking by. Good morning. How's your day going? Everybody knew
Absolutely.
me. When I first got the pen, they were so proud of me. Now, when we first started, they would see me along with the white guys, and they weren't sure what was happening.
Yes.
Okay, so the first time I went through the lunch line, I had a black cashier, and it was like she didn't want to serve me. And she had this frown on her face and everything, and I was with the guys. But eventually, I wear them all down.
Yep.
Okay?
Because you're there every day.
Yes, and they see me, and they can feel my genuineness.
Absolutely.
Yeah.
And and I don't care what their job is. Because I told them, I said, when they were talking about the COVID-19 vaccine, I said, I would rather they give that to the environmental services people who are cleaning the NICU and the MICU than for you guys to tell me it's time for me to go down and get my shot. And they said, shut up, Beverly. You going to go get that shot. Go get the shot.
Yeah.
Okay, so I went ahead and got the shot when they told me they got the shot, because I am seeing pregnant women who are high risk.
Right.
And my specialty is in the area of the fetus as
fetal
a patient.
Yes, exactly.
And so
I know you guys are doing surgeries there.
Yes, we are doing prenatal surgery before birth, correcting defects, doing all kind of interventional procedures.
Mm-hmm.
But be that as it may, I just felt like I was protecting myself enough that other people should have been vaccinated before me. But
I understand. The greater good.
I just said, I'm going to do what you all tell me to do. But these are the people that I feel that are at worst risk.
Mm-hmm.
Yeah.
Every one of our men who's emptying a trash can.
Right.
Okay.
Essential workers.
Yes,
Yeah.
exactly.
Or
And
cleaning
we
their
are
own-
essential,
yeah,
but we
exactly.
never paid essentially.
That's
And
right.
so no matter what institution I've been in, I've always made friends with whoever was in the cafeteria. They would look for me. And and my husband said, they always speak to you. And I said, they want people to know that they know me. And they know that I'm always going to speak back. Some of our people won't speak back. But a lot of times I speak to them before they even speak to me, because I identify with them. I don't care that I have on this white coat,
Right.
or whatever. But that is one of the stories of our race.
Right.
Okay.
Mm-hmm.
Okay. We have to be really honest.
Mm-hmm.
And my husband and I will do, the crabs in the barrel kind of thing.
Yeah.
We talk about one starts to make it up and the others pull it back and whatever.
Mm-hmm.
Da, da, da. And like I said, I have moved on from that. And I think that a lot of my drive was hereditary. I think it must have come from my mom, who was like, the driving force. My dad was way laid back, but my mom was the one that these children and are going to do what they're going to do, and I'm going to encourage them. Mm-hmm. So I told you about the groups of threes. That first three, the older one was inherently brilliant, but he ended up getting involved with the Commodores and dropping out of Tuskegee Institute and traveling to Europe and all these other places.
Just becoming a famous person.
And then the Vietnam War came. And they made him come back to the state of Arkansas and drafted him. That's how he ended up getting out of the group. It was a holy mess. Mm-hmm. Wow. I was the middle one, but I was the more driven one, I think.
You're ready to work.
In the sense that I don't care if he's smarter than me, because my brother could do the physics and the chemistry and all that, and sometimes he wouldn't even have to open the chapter. You just had to talk to him, and he would sort of like absorb it.
He puts it together.
Me, I had to read it, I had to underline it, I want to understand it, I want to do all of that. But I was a straight A student. Yeah. he could have had I was the one, because he would leave his book in the locker. I mean, crazy things like that.
As with anything, it takes hard work and practice to hone the skill.
And then the younger one, the third one in that first group, he was sort of like an average student. He struggled, and he got B's and C's and things like that. But my mom would make the biggest deal over his report card. Okay, because this was expected of me. So I was like, well, what? So
this isn't magic, Mom.
Yeah, so that was my whole life story. But I think everybody in my family, they're proud of me. We all, still communicate, still get along. We have family ventures. We have, for the COVID, we have a big Zoom thing and everybody talks. Yeah. What's going on with so-and-so and
doing
things
the
like
best
that.
we can.
Yeah, and we go to weddings and graduations and all those kinds of things for people and whatnot. But again, from a financial perspective, you can imagine that I am at the pinnacle, but that was not the driving force for any of this. It was just, and I told them, I said, when I went in radiology, I didn't even know it was supposed to be lucrative. I just was doing, I liked it. Yeah. I was stimulated by what was going on, and to be able to tell people, this is what you need to do. And so the surgeons right now will
Travis
say,
calls him the coach.
Yeah,
the coach.
Oh yeah.
That's what
They will say right now, if she tells you something, you can take it to the bank. Mm-hmm. And I keep telling them, I don't need any more praise. I don't need you to say all these things. Don't be doing this, because the MFMs get mad. Okay, and other people, and everything becomes a struggle, because they said Dr. Coleman is going to do all of the first-time evaluations of the patients. Mm-hmm. Okay, when the program first started 25 years ago, they came to Penn from San Francisco, which is where fetal therapy, quote unquote, was invented. And Dr. Scott Azek, who is the Surgeon General at CHOP right now, he loves me to death, and he's always lauding me over other people. But that makes it hard for you. Like when I was in elementary school, they would do that. You need to be doing what Beverly's doing, and you need, and in high school and stuff like that.
Or even in residency, like you said, becoming chief resident.
It makes it very political. Really political, and it makes it tough for people to use you as an example, and it's not necessarily in your best interest. Be that as it may, I have been driven to the point where I had a goal. I saw where I wanted to go, and I was going to do it, and I was determined not to let anybody stop me. And I didn't care if nobody Black had ever done it before, whatever it was. It's time for somebody to do it. Right. Okay?
I heard
so we need to get this done.
100%.
Okay, tell me what I need to do to get this done. So I did not have the highest IQ of all of the kids in my family. But I think the thing that pushed me was that I was the one that was most driven. And people laugh about that doctor being away on a fishing trip thing, but that's what I think drove me, because I kept saying that. Where are the MDs? What is going on? Why should this happen? And that kind of thing. And it's still happening right now today.
Right.
Okay,
What I
the
hear,
maternal death rate for Black women.
yeah,
Is how many more times it is for other women of other nationalities. It is happening right now, and we still haven't corrected everything we need to correct.
That's so
but
true.
we can't give up.
No, and we won't.
No, we won't. We just got to keep moving forward.
Yeah.
And what I love about what I hear from you as a radiologist is just this love for people.
Yes.
You talk about those who should have first access to the vaccine.
Mm-hmm.
You talk about those who are underserved. You're talking about an underserved population.
Yes, exactly.
And now, and we need that passion. We need folks like you in leadership.
We do.
I mean, we're going to talk about it, but the first African American president of the American College of Radiology in 100 years of its existence. And to have someone at the helm.
And now they put me on the Centennial Committee. We want you to be on the Centennial Committee. I said, okay, I'll be on there.
See, saying yes, that's what she'll do.
But that's right. But
Yeah.
my feeling is I may be the first, but I'm like Kamala Harris. I am not going to be the last.
I heard that.
Once I show them that we can do this, someone will come along. It may take 5 years, it may take 10 years, it may take 20 years. Maybe the next one will be a black male, but someone will have to come along.
Exactly.
Someone is going to eventually have to be chair of the board of color.
Mm-hmm.
Okay,
Mm-hmm.
the highest position on the ACR is chairman of the board,
Mm-hmm.
and it took them forever to get a woman.
Yes.
Okay, and they have yet to have a person of color. The most important thing they've done in the American College of Radiology for a person of color is they gave the gold medal to William Allen.
Yes.
Who was
wonderful.
the black radiologist.
Yes. Mhm.
You guys know
Yes.
at Howard University, he established the first radiologic technology school at Howard
That's
University.
right. At Freedman's Hospital, yeah.
That's right.
Yes.
Okay.
Yeah.
And if you look into his history, you should read some of his life story. When he had to go sit for the boards, he was the first person to ever sit for the board. They wouldn't let him ride the passenger elevator.
That's right.
He had to take the freight elevator.
Mm-hmm.
And there was trash on there. And
Yes.
he said he would never forget that smell for the rest of his life.
Wow.
But he went up there on that elevator and he took that exam and he passed it. And then it took forever for states to recognize it.
Right.
I will never forget when I took the American board exam, and I eventually became an examiner on the boards for many years. And I have a lifetime service award from them. But I had a Caucasian Southerner who obviously did not want his hand to touch my hand.
Wow.
This was back in the day when it wasn't electronic.
This is in Louisville.
Yes.
I did
And
Louisville.
they passed,
Travis did not do
I
Louisville.
did not.
they passed the films to you.
Yes,
And
exactly.
they would sit behind you and pass the films forward. So his hand would be on the tip of the film on this end, and he would expect me to touch the tip of the film on that end. If my hand got too close to his hand, he would withdraw the hand and the film would drop, and then he would pick it up and then hand it back to me.
What year is
So,
this? This is like
When I
something
took my radiology board exam.
70s. Wow.
Yeah.
So not only do you have to know the material,
It was
know
like
it cold,
1978.
you have to deal with
1978. This wasn't
It's not that long ago.
someone who doesn't want you to take the test, doesn't want you to touch them.
Yeah.
Like how that decreases your chances of passing.
Yeah.
It just does.
Exactly. And then what happened was that, Penn, as you might imagine, had examiners.
Yes.
Okay, so Murray Delinka, who was our chief of musculoskeletal, he rode the plane back. Okay, and he was on the plane, and people were saying, "Who was that black girl?" Okay, and they were talking, and he realized it was me.
That's right.
And so then he owned up to me.
Wow.
And not only that, he came back. He was a Jewish guy, but he came back to the hospital and told the rest of the people at Penn that everybody on the plane that had examined at the boards was talking about the black girl and who was she and what institution was she from, because they're not supposed to know where you're from,
Right.
No.
in order to keep the bias out of the exam
Exactly.
and everything else. So
Correct.
they didn't know whether I was from Howard or Maher. They didn't know where I was from.
It's either Howard or Maher.
Yeah,
Right,
yeah,
that's
that's
what
what
they
they were thinking even back in 1970,
Right.
78. That's right. But I graduated medical school 70, but this is 1978. But the bottom line is he owned up that I was from Philadelphia, and he had this broad grin on his face, and he was coming back telling everybody.
Yeah.
But it has been a long, hard struggle.
It has.
And the struggle is still there. It's just manifests itself in different ways.
Exactly.
Talk about that a little bit. How does it manifest itself, you think?
Well, I mean, I'm no longer young enough to know what all of the students and the residents are going through, but I see them, and they see me, and I, offer to talk to them, and sometimes they don't often come to complain about a particular staff member or someone like that, but you know that you're doing this podcast because equity and diversity is still a main issue in this country.
So
and you can imagine that still in the 2020s, there are episodes, not just with patients, but with trainees. Like, back in the day, I think I've had one episode in my whole life where the guy obviously did not want me taking care of his wife. But I usually take people off guard. I'll go in smiling, effusive, and I'm Dr. Coleman, and how you doing today? And it puts them, even now, in a certain position. I do that when I walk in the room now, because and a lot of times the sonographers will prep them before I get there.
Yes.
Dr. Coleman is the chief, every patient is scanned by a doctor here at CHOP. They don't do that in the real world because it's too expensive. But here we have the time and energy, and they want a medical doctor to sign off, not just on looking at the images, but on exactly what's wrong with this baby and what's going on with you. So they give them a prep before I get in the room. I walk into the room, I open the door, and I say, because they say we're not patient-facing, I say, hi, I'm Dr. Coleman. I'm the radiologist. I am going to check the baby. Every patient gets checked by a doctor here, and then I'm going to talk with your maternal fetal medicine specialist, and then they're going to discuss everything with you. And I say to them, we do all of the pregnant moms like a jigsaw puzzle. They take a piece from me. If you have fetal MR, they take a piece from MR. If you have echocardiography, they talk to the cardiologist. They take a piece from them. They put everything together, and then when you sit down and have the family meeting, your husband or your mother, whoever's accompanying you, before COVID, we could have 10, 12
many people in the room.
Now we only allow one other person. They can only have one other person. Most of the times it's the spouse. Sometimes it's the boyfriend or the mother if dad is working and keeping the other two kids and something like that. But you allow one other person in the room, and that's it. And we are all masked up. I have to wear goggles when I'm in the room now. We relax that when things look like they were coming down, and then they started to go back up, and they say, you got to put your goggles back on again.
That's
put
right.
your goggles back on. But I understand that life is a challenge, and it is also a privilege, and nobody said it was going to be a rose garden.
Exactly.
So everything that you do as far as overcoming any particular incident or episode or any unpleasantry in your life is going to make you stronger.
Absolutely.
So I am a cup is half full person, period. Okay, and that's sort of the way I look at it. And I feel like some days, why in the world does this happen to me? But that's the way I am. So when Dr. Azig is up there crowing about me, the MFMs know that he will not let them do the first evaluation. And when he came from San Francisco, what he said is, I'm used to working for radiologists. I work with Roy Philly. What's going on here at Penn? And I explained to him what the political environment was at Penn, how interested I was in prenatal diagnosis, anomalies before birth, but how the MFM specialty was developed. And it came along when there was originally only just simple OBGYN, and that we walked in the door of a lot of hospitals saying we're going to take over all of the fetal ultrasound. And I said, they did that here at Penn. And some places like Harvard, Brigham and Women's, they split the lab, and the radiologists run one day and the MFMs run another day. And the MFMs are smart enough to know if it's something wild and they don't know what's going on, call a radiologist to help you and stuff like that. So when he came, he would send one first eval to me and one to them, one to me, one to them. It took him less than 6 months, 3 months. And it was like, he called a big meeting. He said, Dr. Coleman will be doing all of the first time evaluation.
That's right.
And that was it. Because he went in to do surgery and the catheter was not where they told him he was supposed to put it. The diagnosis was not what it was supposed to be. And he said, I need to be as correct can be before I go in if I'm going to do prenatal surgery.
Absolutely.
And the way this works is you do a low hysterotomy. It's like the bikini type incision.
Mm-hmm.
You bring out the part of the baby that's involved. If it's a spina bifida, you untangle the cord, you close the muscle and skin, you put the little buns back in, and you sew the mom up. She's in the hospital 3, 4, 5 days, and then she goes home.
It's amazing.
And we go to Ronald McDonald House, but they have to make sure that she comes back to CHOP to deliver. And we've gotten so comfortable with it. We used to never let them go home. Now they'll let them go somewhere and then come back, and just as long as they're near there to delivery time.
Wow.
But
how many cases would you say you've been involved with since you've been
thousands.
Since you started?
Like I said, the program started. It's 25. It was 25 years old, and we couldn't celebrate because of COVID.
Yeah.
So we're going to have this big grandiose celebration.
Yeah.
Generally, we have what we call a family reunion every June.
Okay.
We have treated patients from all 50 states and multiple countries.
Oh, I'm sure from all over the world. Yeah.
Yes. And the kids come back. We'll have 2,000-3,000 people at the family reunion in June, and they have name tags that are colored. So the hearts will be red.
Yeah.
And GU CHAC will be green, and GI will be blue, and CNS will be yellow, and things like that. And then a lot of the parents, what we do is once we've done a therapy, sometimes we will connect parents up who are going through what another parent had already gone through.
Very
so
important.
They meet other people, they become friends, they talk to one another, things like that.
It becomes a bond.
It becomes a bond. You've got twins, I've got twins. What did you have? 2020 transfusion syndrome. So we do all of that. So when they come back for the reunion, everybody is just, it's a whole day thing. The firemen come, there's rides, and there's cotton candy and candy apples, and there's games and
the most important thing,
painting.
the kids are there.
The kids are there.
Yes.
And not every kid is walking, but a lot of the kids that would have been Jerry Lewis kids are walking with no braces, no assistance, no nothing.
Yeah.
And I look at them like, oh my gosh, that's so and so. She was my and then they will come up to me, and we have gotten a lot of the kids interested in medicine.
I'm sure.
Because they know what they've been through. So some of them want to be doctors and things like that.
And they can do it.
And
absolutely.
Yeah. And we have pictures of them and stories. I mean, it's just a phenomenal program. It's the largest fetal therapy program in the world. But now people are branching out. So, they started one in Denver. And now that we have Children's Hospital built a suite where the pregnant mothers can be delivered in the hospital, and they can go down the corridor and see their babies. At Harvard, for example, you got the Children's Hospital, and then you got the Line-In Hospital where mom's one place and the baby gets transferred to the NICU someplace else. Well, our moms can go up to the NICU and see their kids because they're all in the same hospital.
Yes.
And the desire is so great that recently we expanded because we didn't have enough beds. And they wanted everybody to have their own bed, and they were putting 2 moms together and things like that. So, it is a huge program. I think that it will continue to grow. And I tell people, I said, take the politics aside. Take all of the egos out of this. If you just do the very best you can do for the patient, all of the rest of this stuff will come automatically.
Absolutely.
Exactly.
So
it'll take
for
care of
the
itself.
second year in a row, they have this double Press Ganey Award. CHOP has never had any department get these 2 awards, 2 different medals from Press Ganey in 2 different categories. And now the Center for Fetal Diagnosis and Treatment has gotten the 2 awards last year, and this year we got the 2 awards.
Wow.
That's
Congratulations.
wonderful.
We had to take our picture with the CEO, Madeline Bell, and all the people and everything.
Oh, that's so nice.
But
wow.
I am very passionate. You can probably hear that from my
Absolutely.
voice
I love
about
it.
what I do because I think that you are in medicine to make a difference, and you can come at it from various perspectives. And there are people who are doing incredible oncologic research and things like that, and they're going to discover the cure for this or that or whatever. But to treat life before birth, I think is so fascinating.
That is.
And we are constantly coming up with new procedures and new things to do to try to fix this and fix that. We're even doing research on gene therapy.
Wow.
And we're working with all kinds of new ideas, elastography and ultrasound contrast and things like that. So CHOP is famous for separating conjoined twins.
Yeah.
So we had a pair separated yesterday. Friday. So the reason I work Friday is that I'm pushing my young associates forward.
Okay.
Because, I'm in my 70s. I can't keep doing this forever, and they don't want to let me go. But I'm trying to push the young people forward. So he was in the OR giving ultrasound contrast to the babies to see where is the best place to make the incision to separate the liver portions that they share.
Okay.
They had 2 different stomachs, 2 different bladders. Everybody had their kidneys. Everybody had their extremities. But from the thorax down, the most common, thoracoencephalophagus, their hearts were close together, and you could see their pericardiums touching, but none of the muscles were shared.
But there was a point.
So they knew how they were going to get through the chest. They were trying to figure out how they were going to split the bowel and the liver. And so they gave ultrasound contrast, and you could see the portal and the hepatic veins and everything. And figure, okay, which plane should I go in to make this?
That's so
amazing. And you were integral in planning that. That's wonderful.
So it is such fascinating work that we do. But
what are you most proud of? Your list of accomplishments.
Oh, so many.
So many.
I am just proud that I can do what I do, and that I can give back, and that I can be a face. I can be a face of radiology.
Wonderful.
Okay?
Wonderful.
A face of radiology. So my husband, he knows the editor at the Philadelphia Tribune, so they called to interview me and all that. And they decided that in his boule, they want us to be the first STEM couple, because he's a dentist and I'm a radiologist, whatever. But I want to get as many children of color interested in science as we can get.
I love that.
Okay? And I don't want us to be looked upon as entertainers and sports figures, and I know we can do that tremendously and all
but if you can do that,
but
you can
there
also
are
do
other
this.
things that we can do.
Absolutely.
And so that's what keeps me going. And I told them, I said, you know what? One of the things I found out in the midst of this pandemic is that I'm not good to be at home trying to figure out, okay, what am I going to fix for dinner today? And I'm not into watching soap operas. I can only read so many books.
Right.
I need to be out there among the people. I'm a real social animal. So I said, I will make Dr. Adzik happy and let him know that I'm not leaving tomorrow or this year. My young associate went up for promotion, and he was approved effective as of July 1st, 2022.
Okay.
So I told them, if I can make it to 75 and I'm still okay, I may use that year as the going out year. This August 15th, I turned 73. But I said, I don't know. I'm just taking each day as it comes. And I said, you guys have to realize that me being here is what it is, and I won't make you any real promises, but I'll stay as long as I can stay. But I am very, very comfortable that the young people are moving along at a pace that I am happy with.
Okay.
We just had another young man that's going to start the 1st of July when he finishes fellowship, because the one young man that I had pegged had to go back to Delaware. And so we were down a person, but I want to leave the whole program from a radiological perspective in an excellent position, so they can just keep doing what we've always been doing to the best of our ability.
Absolutely.
And we are right the vast majority of the time, which is how I got the job. And that's why I tell them, I said, you have to keep on being right. I said, don't just look at that image and say, I think that's okay. Put that on your list. So I tell them, I said, give me a check mark. Tell me everything you want me to look after. Ask me any questions. So I still teach all day, every day.
Yeah.
And I am very respected by my sonographers who do all of the preliminary scanning. They have learned a tremendous amount. All of them love what they do.
Yes.
They're happy to work with me, and they are proud of being in the program. And we're just going to keep doing what we do to the advantage of the patients. And a significant percentage of our patients are of color.
Yeah,
and we don't care in the CFDT if you have money, if you don't have money. We have tremendous benevolence from many people. And so we can take people that are on Medicaid and do everything that we would do if they had Blue Cross Blue Shield. That's the way
much
we handle it.
appreciated.
So it doesn't matter.
Yeah, they get the same care.
We offer it to everyone.
Yeah. Wow. That's
and that's another beautiful part of the program.
It's amazing. It just makes your life just more like fulfilled when you're able to like kind of do things like that and be able
if
to.
You're doing, and that's what I told Aaron. I said you have to find a career that will make you want to get up.
Yes,
that's true.
And excited to go there.
Yeah,
there may be tough days.
Something. And every day is not going to be a holiday.
No,
but that's okay. You take it for what it brings, and that's what you have to do.
Exactly.
So she is excellent and top notch at her craft, and she absorbed that lesson from me. And now I'm trying to give it to the little ones. Yeah. You know, it has to be something that you care about, and that you are passionate about, that you really, really want to do.
Absolutely.
And that way you will do it to the very best of your ability.
Yeah.
I have no doubt that the college is headed in a great direction.
Oh, absolutely.
You're gonna work on health disparities and making sure we are a face and improving equity, diversity, and inclusion.
Exactly.
I just think it's great.
I think that speaks for like a lot of people when we saw that you were elected and we saw like the articles about it. I think that it just gives us like a sense of pride. It gives us like a sense of it just feels great to see someone like us doing this.
Absolutely.
And and also gives us like a lot of motivation to like continue. Exactly. Every day is it's tough for everybody. Yep. So to know that you've been through an entire career and you've made it to this point.
And if I can do it, you can.
Absolutely.
That's the message. That's the message. You want someone to look at her and say, I can do that. I want to do that. I will do that.
Yes.
And so, I don't even know if I'll be alive to see the next Black president or the next Black chair of the Board of Chancellors. I don't even know when that's going to happen. It took a long, long time to get here.
Yeah, it did.
A long time, almost 100 years exactly.
Absolutely.
But we're here now, and we're not looking backwards.
No, not at all.
We're here now. We're here now, and we're moving forward.
Exactly. And I was going to say, I think a lot of what you've done, you might not see. You might have radiologists who are like kind of considering becoming like the head of their hospital. And now they see you doing it, and they're like, you know what? Let me go for this.
Absolutely.
So you're not necessarily going to see that thing happening, but it is happening.
The positivity you're spreading is exponential.
Exactly.
You probably won't see it. But it's there.
That is great.
It definitely is.
It is. Thank you for telling me.
Yes.
It is good. It is good to know. You never ever really know what impact you might have until someone gives their testimony.
Exactly.
And so I am out there for people to see me.
Yes.
And I am very, very visible. Yes. And I'm going to continue to be so. Because I think that's important.
Oh, it is. It is.
Just that we're out there.
Yes, just for everyone. And I think even like you said in the cafeteria or seeing like people who are working like custodial services in the hospital, the fact that they can talk to you means they can go talk to their children and be like, hey, you can do this because I know someone doing this. And I talk to her every day, and she is the nicest person I know. So you can do this,
And if they came up to me and say, would you talk to my daughter? I would say, absolutely.
Yes.
Let's sit down and have lunch.
That's why we do it.
Yes.
That's right. Because somebody is always going to be the first, but it is what it is.
Yes,
okay?
Exactly.
And the fact that they can see you.
Yes.
Okay. They have done studies on the, diversity and inclusion to the point where they talk about patients of color with physicians of color.
Yes.
Okay?
Oh, yeah.
Yeah.
And they have documented, and it is true that they do well. Okay.
Yes.
And you want them to feel like you care about them.
Oh,
okay?
absolutely.
Oh, yeah.
It's so true.
And if you have somebody that, doesn't want to touch your hand or, is looking at the sheet that's covering you and all this other kind of stuff and not treating you with the dignity and respect that you deserve, that is not a good thing.
Huge barriers to your healthcare.
Exactly.
When you have that sort of encounter.
Yes.
And it's such an honor and a privilege to walk into a room and to see a patient light up when they see you.
Yes, they do.
It is.
Yes. When I say, I'm Dr. Coleman, I'm a radiologist, some of them will beam.
Yeah. You're going to do the procedure?
Yes.
Yeah.
Exactly.
Some of them will say, and then, and I'll say, did the sonographer tell you I was coming? Oh, yeah.
Unspoken.
Yes.
It's unspoken. But our wives are both internal medicine doctors.
Oh, okay.
So they have that. So they always explain.
So they
have
have experiences that they can tell you about as
exactly.
well.
So they get that same feeling when they see, patients, and they, when they're told, they're going to come into the room, and then you can just tell.
Yes. Sometimes they're very surprised to see you. Now, as the years have passed, I get that less and less and less. Years ago, it was like almost every week, almost every day. Now it's just, they just see me walking back and forth through the dressing room. Yeah, and then I'll see them, months later, and they'll say, "Hi, how you doing?" Because they remember me.
Yes.
And they have a Caucasian couple from North Carolina. I can tell you this story.
Mm-hmm.
They were told that their son had Down syndrome, high risk,
okay.
and they came to me and I said, "No, that's not true." And I said, don't let anybody tell you that. This is not the case. I said, this baby is going to be totally fine. And I said, even if they hint, it is still a possibility. Just ignore them and remember what I'm telling you this day. And I never saw them again after that day. And every patient who comes to see us is assigned a nurse coordinator.
Okay.
And every patient has to go through a genetic analysis. So I found out that they had been looking for me and they didn't have my email and they didn't know how to contact me.
Yes.
But they found their nurse coordinator and they sent the baby picture and they said, "We wanted Dr. Coleman to know that we named our son after her."
Really?
And his name is Cole. C-O-L-E is his first name.
Wow.
In North Carolina, no less. Okay? And he's Caucasian. And this year, they sent me a picture. He's like 7 or 8 years old now.
Wow,
so I have a baby
sweet
picture of him. And then he is so handsome. And I have a picture of him now. And I said, "This is my namesake."
Yes.
And we are a different race. We're both Southerners, okay?
That's true.
Different states, but different race in a different time in the country. They didn't have to do this.
No.
And even if they decided to do it, they didn't have to search for me to let me know that they had done it.
Exactly.
But they did, and I show his picture on some of my lectures sometimes.
That's wonderful. That's so great.
Yeah, these are the things that can happen.
Yes.
When you put all of your stuff aside and do what is best for the
patient can't do what's
Exactly.
best for the
And that's why the surgeons love me so, because they'll say, "Is this bowel dilated?" And I'll say, we don't really have good numbers for bowel. Nobody wants to sit down and measure all the segments of the bowel and come up with a new range of numbers. The articles are all old and they're back in the 80s and the 70s. And we did, "Beverly, is this?" And I said, "Yes, it's normal." So then I have another couple, Caucasian, 3 boys. And the surgeon put me under the microscope and he said, "Beverly, is this bowel normal?" I said, "Absolutely." And I said, "You tell her it's normal." I said, "The numbers are bigger than what I have." But I said, I stood there and I watched it and I looked at the meconium percolate through it. And I said, all of this stuff about this kid's going to have surgery when it's born and a yada, yada, yada. It's not true.
Yeah.
This bowel is going to be normal. We just don't have good nomograms to compare it to.
Yes.
And the baby was born and she sent a picture back of her 2 sons holding the little baby. And she said, "I need you to show this to Dr. Coleman. I wanted to see." We didn't have to have any surgery.
The bowel was normal.
The bowel is normal.
Being definitive, patient care.
Yes.
Those are the lessons.
That's
Being a radiologist,
That's right.
be
Exactly.
helpful.
And you
Exactly.
can't
So
always
important.
tiptoe. Sometimes you
You got to come
step
down
out
on
there.
it. That's right.
Exactly.
Even if you're
Exactly.
not 100% sure you're right.
Yeah.
You say, "In my gut,
That's
that
right.
bowel is normal.
Go with
The
that.
numbers are big. It looks dilated, but it's moving. Everything looks fine.
Yeah.
The wall is okay. There's no ascites. I'm sticking my neck out that this bowel is normal." And I said, "Scott, you're putting me on, you were giving me a hard time." But I said, "My vote is that this bowel is normal. You tell them it's normal."
That's
I
right.
love that, Dr.
Those
Coleman.
that's the nuance and soft skills that you have to learn in radiology.
Yes,
I
you
think
do.
that's part
It's
of the
hard.
training. It's
Yes,
tough.
it is.
And you
It
need a
takes
lot
some
of experience.
experience.
Yeah,
It is.
definitely a lot of experience.
And
so.
you'll put your toe in the water.
Yes.
But eventually you're going to put your foot in the water and you're going to have to jump in.
That's right. And it might not always be
Everything.
warm.
And you got to do it. and it may not be pleasant.
Right.
It might be
Yes.
the polar bear plunge. But
Yes.
you got to take it. Okay, you got to take it.
That's right.
And that's my attitude.
Yeah.
And it has served me well.
I love it.
Oh, obviously. Yes, obviously. Well.
Oh, thank you so much.
Yes, we really appreciate it. We really, really
This has
appreciate
been
it.
great.
You're welcome.
Been
I mean, it's tough on
inspiration.
you guys to drive all the way from DC and then have to drive all the way back.
No,
my
no,
Well
God.
worth it.
No,
Many times
to meet a
over.
legend.
That's right.
I
To meet a legend?
wanted this to be worth your while.
Oh,
And it
absolutely.
has been.
Okay.
Well, let me ask you one more question.
Okay.
So we had a question come in from like a viewer basically, and they were saying like, what would you tell someone who's in medical school now that's having a rough time?
To persevere.
Yes.
Yes.
Exactly. There are no promises.
Mm-hmm.
Medical school is always going to be difficult.
Mm-hmm.
The fact that you decided to go into it means that you made a huge step.
Mm-hmm.
Because you could have decided to get an MBA. That's 1 year.
Yeah, that's true.
You could have decided to go to law school. That's 3 years.
Mm-hmm. Mm-hmm.
Okay, you've got medical school. You've got internship. You got residency. Then you got specialties
Yeah.
for fellowships. You're dedicating 10 years of your life.
Yeah.
I don't care how hard it is.
Yeah.
Never give up.
That's right.
Yes.
That you have to persevere.
Yes.
It is difficult because they want to weed out the people who have what it takes.
Hey.
Okay,
Tell
and
the
I've
truth.
always had that idea.
Me too.
Why did I have to take a foreign language
Uh-huh.
at Vassar in order to get into medical school?
Right.
And Beverly, why did you pick German? Because they said you can't do Spanish, okay, or French, because I had done 4 years of French in high school.
Oh, see.
They said these are the options.
Oh,
you get
man.
German, you get Latin. That's the way it was.
Are you serious?
Yes.
You couldn't. The French that you had prepared for, you couldn't.
Yeah,
Oh,
and
man.
I was like, oh, that's such a rough language. I don't even like doing the words, but I
It
said,
is.
I'll do it.
Yeah.
I'll do it, and I did it.
Yes.
Okay, I got a C. I don't like C's, but I got a C in German. I said,
got it
I don't
done.
care.
There
that
you
I
go.
didn't fail it.
You got
and
it
that's
done.
the most important thing. I'm not failing anything.
There you go.
Okay, I got through it, but I hated it.
Oh,
And I
that's so
said,
funny.
to speak those words. And it didn't matter if I spoke well and this is another thing I'll tell you about Vassar. You could ace the test, and then the teacher would say, I didn't give you a name. I said, well, why not? And she'll say, because of your classroom participation.
Oh.
And you didn't realize that, because of course, going there,
Yeah.
it was culture shock.
It's
Oh,
different.
sure.
So you
Yeah.
were afraid to speak up in the
Yeah.
first few years.
Exactly.
Yeah, by the time I got to be a senior, I didn't give a crap. Okay, 'cause I said, I'm getting out of here and I'm getting my degree.
Right.
But in the first few years, as a freshman, a sophomore, you didn't feel like they cared what you thought about the author was
Right.
thinking. Okay.
Absolutely.
I had one teacher accuse me of plagiarism. She said, I can't believe you wrote this. And I said, you told me
That's so
to
funny.
dig deep, to do all this other stuff, do
Yeah.
all this other stuff. And you didn't like the first, report that I had written up for you. So I delved into this character and I did this and I did all this and I wrote everything for you. And then for you to think that I didn't write it, I got her fired, by the way.
Oh.
Yeah.
No
They let
shout
her
out.
go. I got
Exactly.
her fired.
All right.
But yeah. So, these things keep popping in my head. I'm never going to be able to tell you all of the stories,
Yeah.
but
No, this is.
anybody who's having difficulty in medical school
Mhm.
right now,
Mhm.
you take a deep breath, you
Mhm.
get a nap, you do whatever you have to do, and you wake up the next morning and you tackle the problem.
Mhm.
Okay, and
That's right.
what you got to do.
Don't stop.
Exactly.
Don't
right.
stop.
Get it,
You
get it.
I love
both
it.
said your wives are internal medicine.
Yeah.
They
Yes.
didn't quit.
No.
No.
And you tell your kids, don't quit. Or your
That's right.
relatives, or whoever, your friend's child.
Yeah. We always,
Anybody. Yeah,
exactly.
that's
Don't
right.
get outworked.
No
Don't get
matter
outworked.
what
Yeah.
happens,
Mhm.
don't be discouraged.
Exactly.
There's an old hymnal that goes, don't be discouraged.
Yeah.
Yes.
Gotta keep on.
Oh my God.
Perfect. Well,
Okay.
thank you so
Thank
much
you
for
so
making the
You're
time.
welcome.
We really appreciate it. Yes.
You're
Yes,
welcome. Are we
really
at the
appreciate
end?
it.
Yes.
Okay,
we're
all
at the end.
right,
Yes.
okay.
I know.
So this is going to give you a chance to get back before it gets too dark.
There
It's
you
almost 2:25.
Hit us on IG at Reading Room Talk and drop a line or voice note to readingroomtalk@gmail.com so we can discuss your case. Please subscribe, rate, and review on iTunes or wherever you get your pods, preferably in between cases.